We are pleased to welcome you to the Tuscaloosa Regional Campus and the Hearsink School of Medicine Primary Care Track. Our mission is to train physicians to serve Alabama and our region in primary care and community-based practice, and to develop students with a solid knowledge, not only of patient care, but of community leadership and population health.
The people are very devoted to the students. We take great interest in personal well-being of the students, as well as their academics, their curriculum, making sure that they pass all of their exams. We're very invested in the students, and everybody here is committed to their well-being and their success.
The small student body size, the ability for us to work one-on-one with our students to develop a mentorship relationship with one or more of their faculty is really an important component of what we do.
We get to know the students really well. We work with them one-on-one. They've worked with their preceptors one-on-one. So when it comes time to work with them on their residency applications, we know them really well. We can give them very personalized feedback. Their dean's letters are highly personalized. We can really highlight the experiences that they've had on this campus. Residency programs realize the advantages to being on a regional campus and the hands-on experiences that our students have obtained.
During years 1 and 2, you'll be covering the required basic science curriculum in Birmingham with the rest of your School of Medicine class. In addition, as PCT students, you will get to have some additional clinical experiences with a PCT mentor and learn about primary care, community medicine, population health, and more. We'll start this after the winter break of your first year. Prior to beginning your second year, our students participate in a 2 to 3 week summer program in Tuscaloosa. We'll provide a place for you to stay, and you'll get to learn even more about primary care, learn and practice procedures in faculty-guided simulations, explore scholarly opportunities, refine your understanding of leadership in medicine, and more. Scholarly activity is a 4-year longitudinal requirement for all students in the School of Medicine. The main differences between the PCT and the regular MD track start during the 3rd year. Tuscaloosa students complete clerkships through a hybrid LIC, rather than only traditional blocks. Students also participate in 2 longitudinal courses within this curriculum. Relate is an almost weekly course that covers many of the non-curricular parts of being a medical student, such as professionalism, leadership in medicine, preparation for applying to residency, and the like. LCPM is a continuation for the preclinical curriculum and learning how to apply population, health, and leadership into patient care. It takes place entirely in the integrate portion of the 3rd year. The clinical part of the curriculum is divided into 2 24-week segments: immersion and integrated. During the immersion component, students complete modified blocks in individual disciplines very similar to the structure of clerkships on the other campuses. This is primarily inpatient, and all students complete this in Tuscaloosa. The other 24 weeks is completed in the integrated clerkship, a true longitudinal clinical experience. This is primarily outpatient, but with some inpatient experiences as well. Every student's schedule is unique, but the graphic shows a hypothetical 2-week portion of the curriculum. Most students will complete the integrated component of the curriculum in Tuscaloosa, but some will have the opportunity to participate in our Community Integrated Experience, or CIE. In Tuscaloosa, students will see patients at University Medical Center with our full-time faculty and with some of our adjunct faculty in the Tuscaloosa area. Our faculty have a vested interest in turning out well-trained and well-prepared medical students, and we hope that some of you will want to stay with us after graduation in our family medicine and psychiatry residency programs. A few students will be selected through an application process during year 2 to participate in our CIE. These students will complete the integrated component of the year at one of our approved community hub sites. Currently, these sites are in Pell City, Demopolis, and Enterprise. We train local doctors to train our students and teach them how to be small-town rural docs. Regardless of whether you want to end up in a small town, you'll learn with a lot of autonomy and learn even more about the business side of medicine and what it means to be a leader in a community. The 4th year of medical school has a lot of flexibility. Like the regular MD track, the PCT has 3 required 4-week acting internships. Ours are slightly different than the other campuses and will be completed on the Tuscaloosa campus or one of our approved community sites. Electives, an additional 18 weeks of which are required, may be completed on any of the School of Medicine's 4 campuses or as an approved visiting elective at another institution. Additionally, All School of Medicine students will complete a 2-week preparation for residency course. Our students are trained in the same disciplines as all the other campuses, just in the unique structure of the LIC. All students will take 2 shelf tests in the first half of the year and 5 in the second half. Which ones vary depending on whether you start on immersion or integrated. Based on published evidence, students trained using an LIC finish medical school with greater empathy and even more prepared for internship. Students also do just as well, if not better, on standardized tests.
They realize the strength of the hybrid curriculum where they get to experience the immersion models, but they also get that longitudinal component, which a lot of residency programs really value. So that is another way that our students have an advantage when they're looking at these competitive residencies, is they can talk about what they learned in our program.
If a student's interested in primary care, interested in community-based practice of almost any type, we are going to offer an experience that allows them to develop that interest, to make sure that that is something that they want to do. I think we have a special group of people here.
We're very proud of the fact that all of our faculty and staff are involved in medical student education, and I think we all play a critical role in nurturing them and helping them matriculate through a very rigorous curriculum and really preparing them for their next steps, which is residency, on their way to become outstanding doctors.
We hope that you will be interested in applying to the primary care track. Applications are made through the UAB Hearsink School of Medicine using AMCAS. You will then indicate your interest in the PCT on the secondary application. The PCT provides neither a competitive advantage nor disadvantage to being accepted to Hearsink. The admissions criteria are identical. We're looking for students who also share our interests in primary care and caring for our communities. Good luck during the interview process, and we hope to see you at one of our interview sessions soon.